Well, so CheckMate 577 was a global randomized phase 3 trial that got FDA approval after originally presented in 2020, where we showed the disease-free survival for the use of adjuvant Nivolumab after chemoradiation and surgery in operable esophageal and GE junction cancers who had residual pathologic disease. In that study, we randomized patients in a 2-to-1 manner to either get Nivolumab for up to a year or placebo. Now, in the original presentation, we showed disease-free survival as the primary endpoint, with a doubling in disease-free survival with a hazard ratio of 0.69. Yesterday, at the oral abstract session, we presented the final analysis of the secondary endpoint of overall survival. Now, what we showed there was that adjuvant Nivolumab improved overall survival by 16.4 months versus placebo, but it wasn't quite meeting statistical significance. We also showed a doubling in the disease-free survival over 5 years now follow-up, from approximately 11 months to over 22 months. And we showed distant metastasis-free survival was also improved. The other interesting thing that came out from the research was we were able to show for the first time that the immune score, the PD-L1 CPS score, was important in early stage disease. And if we take away those patients that had an immunologically cold tumor and they had a hazard ratio of 1.14, we actually showed that the other 90% had a hazard ratio of 0.79, indicating that we could enrich for efficacy in those tumors that were immunologically hot. And then one of the last things we did is we looked at a 2-step method analysis to account for subsequent treatments, because we know in a large overall survival study where patients got adjuvant Nivolumab for just 1 year, they subsequently got a lot of subsequent treatments, and there was an imbalance between the arms. So we did this 2-stage method to determine what the impact of subsequent treatment was, and if we removed that effect of subsequent treatment, we showed a hazard ratio of 0.73. So really a very exciting result for the trial, and I think still positions adjuvant Nivolumab as a standard of care in patients around the world with operable esophageal and GE junction cancers who get chemoradiation and surgery followed. Now you could have adjuvant Nivolumab for a year.